What are some of the recent trends that we're seeing today in breast augmentation? First of all, there's been a trend towards moving the implants above the muscle in what we call the subfascial plane. If you have the breast tissue here and the muscle here, there's a layer of fascia or connective tissue over the muscle, and that's where we put the implants, instead of putting it like we do traditionally under the muscle. And so what are the advantages of that? Well, the biggest advantage is that you don't get an animation deformity. And so because the implant's not under the muscle, when you're flexing and moving that pectoralis major muscle, you're not getting any movement. And also in those patients where the nipple tends to ride a little bit low on the breast, but not low enough that they absolutely need a lift, sometimes if we put the implant above the muscle, I think it tends to fall a little bit nicer in the breast pocket and give those patients a really natural teardrop without the nipple looking too low. Another innovation is using an actual mesh, a biologic tissue that is put into the pocket of the breast implant in order to help support that lower pole. In my practice, I find that the best use for mesh is not really with a primary augmentation in someone who hasn't had breast implants before. I think the value really is in a lot of the revisional patients where the skin has been stretched, where the fold has been stretched and the fold is being reconstructed, and I like to use that mesh in order to support that fold. And finally, it's not really an innovation, but it's a trend that's always been in my practice, and that's using smaller implants in general. There are a lot of women that are realizing that they don't have to go big and they don't have to look augmented in order to get their bodies back the way they want.